My name is Dr. Brooke Pearce. I'm one of the vestibular audiologists here.
My name is Adam Law. I'm a physical therapist here at the Dizziness and Vertigo Institute at 8641 Wilshire Boulevard. So we treat a wide variety of dizziness and vertigo conditions, also balance conditions, post-concussion, and really using vestibular rehabilitation as our main approach to help these patients get back to their functional life.
The long and short of it is we're trying to see how the vestibular system is working when it's in a static state. So her eye recordings give us a really good input of what the ear signal is, and then lets us know if there's any asymmetry or any difference between the right vestibular system versus the left side. Essentially what's happening with the spinning right now is we're looking at different thresholds or different frequencies that happen in the real world. So we want to know how her body from a vestibular standpoint is working, and what this chair will do is it takes the whole system, so the right ear and the left ear, and then what it does is it makes the system work. And so we pick up how the brain is integrating the signal coming from the ear, how it's actually being cross-checked with a signal from the eye, and then overall the health of the system from a symmetrical standpoint, but also from a threshold standpoint. This is actually called the TRV, so it's used specifically for a certain type of dizziness called BPPV, which is benign paroxysmal positional vertigo. And then essentially what's going to happen is we're going to activate different parts of the vestibular system. So there are 6 semicircular canals. We want to move her in different positions so that we activate each one of those 6 semicircular canals. The goal is to identify if there's any type of abnormality in the system from a structural standpoint.
This is testing the 3 systems for balance that we use. We use our visual system, our vestibular system, and our feeling in our body from the head down, the somatosensory system. We're going to get these different conditions, and at the end it's going to give us analysis of how the sensory organization test, an analysis of how we're using those 3 systems and which one we're stronger in, which one we're weaker in. In this setting, we're trying to really see about that vestibular system because it can pair well with the other diagnostic tests that we're doing over there in the audiology testing. What we're doing is we're doing the rehabilitation right now. We are doing what's called optokinetic training. This is a form of rehabilitation that's desensitizing her visual system. She gets dizziness a lot when she's in grocery stores and malls and busy environments, and this is actually going to help her be able to tolerate those environments better and be more functional by doing this type of visual therapy.
So we would love for you to visit our website. Website is www.dizzyandvertigo.com, and then directly contacting us via phone. Our patient care coordinators are very good, extremely thorough about walking you through the process, about getting an appointment scheduled, or collaborating with any specialist you've previously seen.